Aidplast sterilized hemostatic pressure plaster is manufactured to enhance the comfort and convenience of dialysis patients or individuals with arterial venous access sites post-procedure. It facilitates faster and more convenient closure of puncture sites compared to tape and gauze. Before taking out the needle, the healthcare provider should peel off one of the two protective papers covering the adhesive part of the Aidplast pressure plaster. The puncture or graft site should be covered with the sponge part of the pressure plaster, making sure to attach the exposed adhesive to the skin next to the site. The healthcare provider should remove the needle while simultaneously covering the puncture site with the sponge part of the Aidplast pressure plaster. After removing the needle, the healthcare practitioner should promptly press down on the sponge and remove the second peel-off release paper. Then, firmly attach the second adhesive part of the dressing to the skin. To ensure a sealed closure around the puncture site, all sides of the sponge should be pressed down. This guarantees that the puncture site is isolated from bacteria, forming a barrier against any blood leakage as it closes, and thereby minimizing the risk of bloodborne contamination to others. The healthcare provider should maintain consistent pressure on the sponge for 1 to 2 minutes while it absorbs and expands. Subsequently, the patient should apply also pressure for an additional duration. The sponge pad expands when it contacts with blood and becomes several times thicker than its original size. It's attached to a plastic adhesive tape with low stretch, and when pressed down onto the puncture or graft site, it localizes and increases the direct pressure needed to close the site as fast as possible. The gentle but firm pressure enables the epithelium to close and begin the healing process without disrupting normal venous and arterial flow after dialysis or sampling procedures. The Aidplast hemostatic pressure plaster does not contain medicinal products, human blood derivatives, tissues of animal origin, phthalates, perfluoroctane sulfanoate, PFOS, and latex. Hope you feel better soon. Aidplast, pioneer in medical plasters.